So why would you buy dental insurance? Well, for starters, it gives you all the benefits of regular cleanings, checkups, and preventive care. And with insurance, most dental costs are easy to anticipate. Even less obvious dental needs can be predicted or avoided by regular checkups. But just as with your other coverages, how do you choose a plan that covers the dental care you and your family will need? A dental maintenance organization, or DMO, is most often a lower cost plan. You choose an in-network primary care dentist, or PCD, to coordinate your care. If you need to see a specialist, your PCD will refer you to one. If your plan covers orthodontia, though, you don't need a referral to see a network orthodontist. Preventive care is covered at 100%, and you have a fixed copayment for most of your services. A DMO plan offers peace of mind with no deductibles, annual maximums, or claim forms. With a preferred provider organization, or PPO, you don't need to select a PCD, and you never need a referral to see a specialist. But costs are usually lower if you do choose a dentist inside the PPO network, and network providers will file claim forms for you. PPO plans pay a percentage of covered services, or a coinsurance, after you meet a deductible, and annual maximums do apply. There are also age and frequency limits for some covered services, meaning you can only get a certain number of certain services during the plan year. Freedom of choice plans are like two plans in one and offer a high level of flexibility. You choose either the DMO or the PPO, but freedom of choice allows you to switch between the two as your needs change. So begin the year by selecting one plan, like the DMO with no deductibles or annual maximums, and later in the year switch to the PPO plan. It's that simple. You can switch plans every month. Just make sure you notify the insurance company first, and remember, your out-of-pocket costs usually are less when network dentists are used. So, what's included? As you review your plan options, it's helpful to understand how services and procedures fall into certain categories. Preventive services typically include routine cleanings and exams, x-rays, sealants, fluoride, and other preventive services. Basic or restorative services usually consist of fillings and simple extractions. Root canals can be considered basic or major. Major procedures include crowns, bridges, dentures, partials, surgical extractions, and more. These services may be subject to different deductibles and coinsurance amounts than routine cleanings and other basic services. Orthodontia is often a separate level of coverage that may or may not be covered under your plan. And insurance does not usually cover elective or cosmetic services and oral surgery, like teeth whitening or dental implants. So, how do you decide which plan is right for you? Let's summarize. A DMO plan may be a good option if you are willing to see dentists in the DMO network, you like having one PCD coordinate your dental care, you have a young family and need a lot of preventive services, or you are thinking about going without dental insurance and want a low-cost option. A PPO might be a good option if you would rather not select a primary care dentist, your dentist is not in the network but you still want some level of coverage, and you want the freedom to visit any licensed dentist without a referral. A freedom of choice plan may be a good option if your primary dentist is in the DMO network and you like the lower premiums and no deductibles, but you want to see an out-of-network specialist for an upcoming surgery later in the year. You also want the freedom to visit that specialist without a referral. So, as we look at the different plan options, it's helpful to keep a few things in mind. Remember, the cost varies depending on the type of dental plan you choose, so have an idea about how much of a monthly premium you are willing to accept. If you have a favorite dentist, if so, and he or she isn't in the DMO network, it may be worth paying a little extra for a plan that allows out-of-network coverage. And other than routine care like exams and fillings, you might want to consider whether you or a family member may require or want specialty care, such as dentures, tooth implants, crowns, or bridges. And if you have a family history of poor health, you should look at the restrictions of each plan closely to ensure the least number of restrictions for your range of treatment. And finally, the annual or